Good afternoon, and thank you for joining us for today's NILE webinar. This is Brianne Van Dyne, the Education Manager for Immunize Nevada, and I will be today's moderator. Before we get started, I'd like to review a few housekeeping items. First, if we should become disconnected for any reason, please call back and we will continue. Second, please locate the chat box in the bottom left-hand corner of your screen. If you have any questions, type them in that same chat box and we will address those questions at the end of the presentation. Lastly, if you have requested nursing or pharmacy continuing education credits for today's webinar, please make sure you complete the survey in the post-webinar email. The email will be sent out by the end of today, and all CEUs will be mailed out on Monday, March 25th. Before we begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to the benefit of the coalition. The expectation and goal is for community partners to gain knowledge on immunization-related topics through a non-branded, unbiased presentation. I'd like now to introduce our speaker for today, Ashley Brooks, who is a health communication specialist serving as the lead for the adult and maternal immunization communication campaigns at the CDC and the National Center for Immunization and Respiratory Diseases. Ms. Brooks previously worked on seasonal influenza communications in CDC and CIRD. Prior to her time at the CDC, her experience includes working with to execute programs related to diabetes management and breastfeeding health. She has a master's degree in public health from the University of Tennessee, Knoxville. Thanks for joining us, Ashley.
Thank you. Can you hear me?
Yep, we can hear you.
Perfect. Thanks again for having me today speaking on this webinar. I do want to give a little bit of disclaimer that I think the universe knew that I was speaking today about vaccination, so I think I may have the flu. So excuse in advance any sneezing, coughing you may hear. So let's go ahead and get started. And as Brianne mentioned, my name is Ashley Brooks, and I lead the adult maternal vaccine campaign programs here at CDC. So here is my disclaimer slide. Not much to really say here. Oops, sorry, I'm having trouble switching it. Okay, so our presentation objectives for today include discussing findings and guiding principles from research with pregnant women and prenatal care providers, understanding the barriers and facilitators to vaccinating pregnant women, discussing tips for communicating with pregnant women about vaccination, and discussing the vaccine resources and materials for pregnant women and prenatal care providers. Okay, I saw on the side. I hope the sound was fixed. I'm sorry about that. So first, let's discuss the importance of maternal immunization. I know a lot of this is probably content and information that you have heard, but definitely worth going over to reinforce. So on this slide, you will, oh, it's behind a little bit, sorry about that. Brian, I'm frozen. Oh, there it is, okay. So this chart lists key vaccination recommendations for before, during, and after pregnancy. It's a quick reference table summarizing important contraindications and recommendations related to maternal vaccination. So as you can see here, I have highlighted the 2 routine vaccines that are recommended during pregnancy. And then also a routine vaccine that I also want to call out, which is towards the bottom, is that is recommended before pregnancy, is the MMR vaccine. So live vaccines administered to pregnant women pose a theoretical risk to the developing baby. So live attenuated virus and live bacterial vaccines are contraindicated during pregnancy. And so flu, on this slide we're going to talk about influenza in pregnancy. So flu is more likely to cause severe illness in pregnant women than in women who are not pregnant. This is contributed by the changes in the immune system, the heart, and the lungs during pregnancy, making pregnant women more prone to severe illness from flu. Flu may also be harmful for a pregnant woman's developing baby. The flu shot, the flu shot given during pregnancy has been shown to protect both the mother and her baby for several months after birth from flu. Pregnant women have protective levels of anti-influenza antibodies after vaccination. Passive transfer of anti-influenza antibodies that provide some protection from vaccinated women to their babies has been reported. Vaccination of women while pregnant reduces risk for flu infection and hospitalization among infants younger than 6 months of age. We know this is important since infants younger than 6 months of age are too young to be vaccinated themselves. CDC, the American College of Obstetricians and Gynecologists, the American College of Nurse Midwives, the American Academy of Family Physicians, and the Advisory Committee on Immunization Practices, or ACIP, recommend influenza vaccination for women who are or will be pregnant. So on this slide, we have the history of recommendation for flu vaccination during pregnancy from the ACIP. So 1,957 deaths promoted and prompted the 1960 recommendation. Subsequent years were not mentioned, but later noted in the 90s, second and third trimester were high-risk periods. So that brings us up to the current 2007 updated recommendation that any licensed, recommended, and age-appropriate trivalent, quadrivalent, and recombinant inactivated influenza vaccine can be administered during pregnancy. So we're going to talk about switching over to the other maternal vaccine, which is pertussis. So pertussis is a nationally notifiable disease. Clinicians should notify the appropriate health department of all patients with suspected pertussis or whooping cough. Since 2010, CDC sees between 10,000 and 50,000 cases of whooping cough each year in the U.S. There are reported cases in every state. Whooping cough disease is most severe for infants. Pertussis in infants causes them to stop breathing and to turn blue. About half of babies who get whooping cough end up in the hospital. Hospitalization is most common in infants younger than 6 months of age. Of those infants with pertussis who need treatment in the hospital, approximately 61% will have apnea, 23% will get pneumonia, 1.1% will have seizures, and unfortunately 1% will die. Other complications of whooping cough include anorexia, dehydration, difficulty sleeping, hernias, and urinary incontinence. Pertussis is an endemic in the United States with peaks in reported disease every few years and frequent outbreaks. Although many reported cases are not diagnosed and therefore not reported, this slide gives us an idea of the number of cases we see, about each year. Pertussis cases have steadily increased in recent decades, with more than 20,000 reported cases in recent years. In 2017, there were more than 18,000 cases, including over 2,200 cases and deaths in infants under 1 year old. We don't have the final numbers for 2018, but as mentioned, and as you saw in the previous slide, provisionally for 2018, the number has gone up to over 13,000 cases. While these numbers may seem high, we no longer see 200,000 cases each year like we did before we had the pertussis vaccines. So switching gears again back to the burden of influenza. So influenza is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness, which can result in hospitalization or death. CDC estimates that flu has resulted in between 9.3 million to 49 million illnesses, between 140,000 to 960,000 hospitalizations, and between 12,000 and 79,000 deaths annually since 2010. Deaths in children with lab-confirmed influenza are reportable in the U.S. The number here, 183, has now been updated to 185 pediatric deaths during the 2017-2018 flu season. Anyone can get, anyone can get flu. even healthy people. And serious problems related to flu can happen at any age. But there are certain people who are at high risk of developing flu-related complications if they get sick. These include children younger than 5, but especially children younger than 2 years old, adults 65 years of age and older, pregnant women and women up to 2 weeks postpartum, and residents of nursing homes and other long-term care facilities. So pertussis, or whooping cough, is a serious vaccine-preventable disease that has made a comeback, unfortunately, in recent years. So newborns can catch it from their parents, siblings, or others that they may come in close contact with. As you might know, most deaths are among infants who are too young to be protected by the Childhood Pertussis Vaccine Series Tdap that starts when infants are 2 months old. And as I mentioned, infants are at the greatest risk of contracting pertussis and having serious potential life-threatening complications. So down to the importance of vaccination, maternal Tdap vaccination helps protect newborns by passing those antibodies we previously mentioned, so proteins produced by the body to fight off diseases, to the baby before birth. So fewer babies will be hospitalized for and die from pertussis when Tdap is given during pregnancy rather than during the postpartum period. Cocooning, the term cocooning, it refers to vaccinating anyone who comes in close contact with an infant. So cocooning alone may not be effective and is hard to implement. So here we have the vaccine recommendation. In 2012, the Advisory Committee on Immunization Practices, or as I mentioned, ACIP, voted to recommend that healthcare providers administer a dose of Tdap during each pregnancy. So that's each pregnancy. Tdap vaccination providers direct protection for mom and Tdap vaccination provides indirect protection for mom and indirect protection for baby by the passive antibody transfer that I've mentioned. So getting Tdap during gestational weeks 27 to 36 weeks, which as you know is the third trimester, is 85% more effective at preventing pertussis in infants younger than 2 months old. Postpartum Tdap administration only provides protection to the mother. It does not provide immunity to the infant. It takes about 2 weeks after Tdap receipt for the mother to have protection against pertussis. Thereby is vaccinated postpartum, she is at risk for contracting and spreading the disease to her vulnerable infant during this time. To maximize passive antibody transfer to the infant, healthcare providers should administer Tdap during the early part of gestational weeks 27 through 36. The level of pertussis antibodies decreases over time. So you should administer Tdap during every pregnancy in order to transfer the greatest number of protective antibodies to each infant. And the American College of Obstetrician Gynecologists and the American College of Nurse Midwives also support this recommendation. And as I mentioned on the previous slide, cocooning alone may not be effective and it is difficult to implement. Since ACIP recommended since 2005, full implementation of cocooning has been proven to be a challenge, limiting its impact as an independent prevention strategy. Cocooning in combination with maternal Tdap vaccination and administering childhood Tdap series on schedule provides the best protection to the infant. So on this slide, similar to the influenza information, is the history of the recommendation for Tdap vaccine during pregnancy. So you see in 2006, Tdap booster to postpartum mothers and family members, also that term cocooning that I mentioned was administered, but now bringing us down to the 2012 recommendation, it replaces the original recommendation that pregnant women should get the vaccine only if they had not previously received it. So the 2012 recommendation is Tdap for every pregnant woman at every pregnancy, regardless of prior immunization status, optimally between that earlier period of 27 to 36 weeks gestation. Oops, skip this slide. So here's a summary of CDC's, I know it's a little small on the screen, but it's a summary of CDC's maternal immunization recommendations, the ones that I've just gone over. This fact sheet was developed in collaboration with the American College of Obstetrician Gynecologists. So it clearly shows which vaccines are indicated during every pregnancy, which are flu and Tdap, may be given during pregnancy in certain populations, are contraindicated during pregnancy, and can be initiated postpartum or in breastfeeding or both. And this fact sheet is now available on CDC's website at the link that's on your screen. Sorry, happy fingers here. So CDC's research helps us develop communication strategies and materials based on information that both general consumers and healthcare providers are seeking. The goal is to get a better understanding of knowledge, attitudes, and behaviors regarding maternal vaccines, and also to provide a better understanding of provider needs and recommendations. So first, we must understand the knowledge, attitudes, and beliefs when it comes to vaccination. CDC conducts both formative and evaluation research with pregnant women, parents, and healthcare providers to inform its immunization education and outreach. So to do this, CDC, we use several methodologies, including focus groups, in-depth interviews, online surveys, and polls. This research helps CDC better understand the audience's knowledge of diseases and vaccines, and also helps CDC track knowledge, attitudes, and beliefs of self-reported activities over time. So in 2014, CDC conducted mixed methods research comprised of surveys, focus groups, and in-depth interviews. The survey of pregnant women was an online survey of U.S. women ages 18 to 45 years of age. There were 487 respondents that were eligible and completed that survey, and the data were collected in June and July of 2014. Additionally, CDC convened focus groups with those pregnant women. There were a total of 28 focus groups of pregnant women in high pertussis incidence, so San Diego, and low pertussis incidence, Atlanta location. The groups were segmented by parity and language, so we had both English and Spanish. Participants were also a mix of trimester, race and ethnicity, and socioeconomic background. There were 2 rounds of focus groups conducted, so both of those were conducted in June and September, October of 2014. For the provider audience, there was a survey of OBGYNs. The online survey was sent to 32,000 members of the American College of Obstetricians and Gynecologists. The respondents they all offered prenatal care, so we wanted to make sure that we captured that. Data were collected in both February and March 2014, and we had over 2,300 respondents complete the survey. For the in-depth interviews conducted with the OBGYNs, those interviews were 60-minute telephone interviews with OBGYNs nationally. The respondents all offered prenatal care. The interviews were conducted in May and June of 2014. So findings from this research gave CDC a better understanding about both of these audiences regarding maternal vaccination. And now I'm going to go through some of those findings. Just kidding, when we go through the next part of the research, I'm skipping ahead here. So at CDC, we want to continuously look at the most up-to-date data. In the winter of 2016, CDC conducted additional research with both pregnant women and healthcare providers. So we administered an online survey, which included some message testing, and it was administered to pregnant women. So in that survey, there were 251 pregnant women aged 18 to 45 years in the U.S. receiving prenatal care. There was mixed household income and age and experience with pregnancy, and the range of intention for flu and Tdap vaccination varied. And in addition to those online surveys with pregnant women, we also had in-depth interviews, or IDIs, we also conducted with healthcare providers. So we had 16 OBGYNs and 8 certified nurse midwives, and they were across all regions of the United States, and they included those that provide Tdap on-site and those that refer out. So now, excuse me. Now, the key findings. Sorry about this. I'm like having issues right now. So now the key findings. So as we see from the results, there was a low awareness about pertussis, flu, and vaccines. 69% of pregnant women reported receiving a flu vaccine recommendation, and 41% reported receiving a Tdap vaccine recommendation. So messaging around protection for their babies was actually very important. As we probably all know, pregnant women are high information seekers, but are not actively seeking information about maternal vaccines. So kind of weird there. They want to receive vaccine information from their healthcare providers, and they have questions about the recommended maternal vaccines. Some more key findings. So as far as the vaccine recommendation, 69% received flu vaccine recommendations and 41% received Tdap vaccine recommendations from their healthcare providers. About 60% of those who received recommendations for flu or Tdap vaccine were told the vaccine was extremely or very important. Regarding vaccine acceptance, more respondents had gotten or intended to get flu vaccine than Tdap. So for flu vaccine, we had about 59%, and then the intention around Tdap was around 42%. So actually 28% decided not to get each of these vaccines. For vaccine decision-making, pregnant women get vaccines because their prenatal care providers recommend them or because they heard the illnesses could harm their babies. They want information about the safety and individual vaccines, side effects, and vaccine ingredients. So CDC did a longitudinal panel study with 200 women from second trimester of pregnancy to child's 19th month of life, starting in 2013. The objective was to learn about their knowledge, attitudes, and plans related to vaccines for their babies. So as we see on this slide here, the initial survey showed that 85% of women had already made a plan for vaccinating their babies by their second trimester. So this is what they had decided. 75% were planning to receive all vaccines recommended by their child's doctor or nurse. 10.5% were planning to delay or space out some vaccines. 4% planned to receive some but not all vaccines. And 10.5% had not made up their plans for vaccinating their babies. So a key takeaway from this is that women are making plans for their babies' vaccines very early, even before their babies are born. And it's important for them to consult credible sources of information to get their questions answered. For example, prenatal care providers can encourage pregnant women to meet with a pediatrician before the baby is even born. So how healthcare providers should talk and could talk about maternal vaccines. In the in-depth interviews that we conducted, we learned how providers talk about maternal vaccines to their pregnant patients. Most use similar Tdap and flu vaccine messages with their patients. Most discuss Tdap and flu vaccination concurrently during the initial intake visit. So to help facilitate those conversations, they may use printed materials to help educate their patients about the recommended vaccines. Some key message themes to facilitate vaccine conversations include disease susceptibility and severity, vaccination benefits, so that includes protection and that passive immunity that we talked about with the antibody transfer, and of course vaccine safety. Certified nurse midwives, we found, were more likely than OBGYNs to actually feel uncomfortable about making a strong recommendation for either vaccine, as they view it as a patient decision. So that was something we definitely learned since we included them in our interviews, and that was, a really big takeaway for us. So some guiding principles for pregnant women. So we found that levels of awareness of pertussis and perceived susceptibility to the disease are low among pregnant women. Pregnant women are primarily concerned with the health and safety of their babies when making decisions about vaccines during pregnancy. And pregnant women view their OBGYNs, midwives, or even other healthcare providers as the ultimate authority on pregnancy-related topics. So that's really, really important. So some guiding principles for OBGYNs. We found that the knowledge of the Tdap recommendation during pregnancy is high, but the perception of their patient's individual risk and their babies is often low. So also we found stocking Tdap within a practice is a barrier for some OBGYNs due to issues with reimbursement. The most common channels for sharing vaccine information with patients are face-to-face during office visits and in handouts at the first prenatal appointment. Prenatal providers have noted that they pair Tdap recommendation with the timing of the glucose tolerance test. So also that we found some flu vaccination barriers and facilitators in pregnant women. Some of those barriers were specifically related to flu. They are low perceived susceptibility and severity of the flu illness and flu virus. They have safety concerns about the flu vaccine. They are concerned about the side effects of the flu vaccine. And, of course, the one that we all know, I'm sure, is how well does the flu vaccine work. So definitely they're focusing on the vaccine efficacy. Some facilitators for them around the flu vaccination is that providers offer, not only just offer, but recommend, and, you know, of course it helps that they're storing the vaccine in their office so they can get it all done in one day. Also, just another facilitator is around education and awareness of the severity, where you can get your flu vaccine, and all of the complications related. And, of course, the motivator for flu vaccination uptake, and also with Tdap vaccination, is also just that protecting the baby is the strongest motivator for vaccination among pregnant women in our focus groups that we found. So let's talk about the best ways to reach pregnant women. So during our research, we identified the best ways to reach them. Pregnant women get maternal vaccination information from three main sources. 80% they get information from their healthcare providers, and as we've noted, that they're the most important source, and 60% cited them as the most important source of information. 50% of their information comes from internet health resources, and then 33% come from family members and friends. So while they're not actively looking for, information around pregnancy, they're not actively looking for information about the vaccines needed during pregnancy. So, you know, another way to reach pregnant women is that some women may be prompted by messages they see online to ask their healthcare provider about more information around maternal vaccination. So now, let's talk about the role of the healthcare provider. So we've seen the vaccine coverage, the importance of vaccines, and some knowledge, attitudes, and beliefs of pregnant women in regard to immunization. So how can we encourage them to get the recommended vaccines they need? So as a healthcare provider, we know that pregnant women have a ton of questions about vaccine recommendations. They realize they need the vaccines, and they just may not have all the information. Some of these questions most often heard are, you know, is the flu vaccine safe for me and my baby? Why is vaccination needed every pregnancy? You know, isn't it enough to make sure everyone around my baby is vaccinated? Or, you know, just the simple stay away from people when they're sick. They may look to many sources for pregnancy information online, and I've listed some of the key sources I'm sure a lot of you are familiar with. They are high information seeking. It's important to note here that while most are seeking the information on healthy pregnancy, like I've mentioned many times before, they are not searching for vaccine information. Because there are numerous existing sources, there is also a need for clear, credible, and consistent information. So the National Vaccine Advisory Committee, or NVAC, revised the standards for adult immunization practice in 2013. So these standards have been implemented for any adult care. So all healthcare providers, including those who do not provide vaccine services, have a role in ensuring that adult patients are up to date on their vaccines. So these practice standards can include assessing vaccination status of all patients at every clinical encounter, strongly recommending the vaccines that patients need, administering needed vaccines or referring to a vaccine service provider, and documenting the vaccines received by the patients in state vaccine registries if they exist in your state. Another way that healthcare providers can increase vaccine uptake is to present vaccination as a standard part of their obstetric care. So provide patients with information and resources about maternal vaccines during her first prenatal visit so she knows what's coming, and be sure to mention the time frame for each vaccine when discussing her pregnancy. You can ensure your staff deliver consistent messaging about the importance of maternal vaccines, and that staff can include nurses, front office staff, managers, etc. You should normalize vaccination as part of patients' emergency care. So an example of that would be, it's October and flu season is coming up. This means it's time for your flu vaccine. So unless you need more information on the flu vaccine, I'll have the nurse bring it in. So now let's talk about making a strong flu vaccine recommendation, and what does that entail? And I apologize if this slide may be a little distorted and has a ton of information on it. But this chart shows the results from the Internet Panel Survey of flu vaccination coverage before and during pregnancy from patients who visited a healthcare provider at least once. So just to provide clarification and definition, so no recommendation is no recommendation of flu vaccine given. Recommended but not offered is the recommendation of flu vaccination given, but vaccine was not offered to be administered on-site or at all. And then offered, of course, is vaccination is available on-site, ready to be administered to the patient. And then all of these vaccination results are based on self-report. And as you can see on this slide, that 97.9% visited healthcare providers at least once during their pregnancy. And when recommended and offered vaccination from obstetric providers, vaccine acceptance is 5 times to 50 times higher in pregnant women. So a strong recommendation makes a difference. Though there are numerous sources pregnant women turn to for their most trusted source, of course, their OBGYN, their midwife, their pharmacists, clinical providers. In our research, most providers say they recommend vaccines to their pregnant patients, yet we see that coverage rates continue to be around stagnant. So we're trying to figure out, where's the disconnect? So what we're focusing on is that a strong, effective vaccine recommendation makes a difference. It is important for providers to talk to their pregnant patients about the importance of on-time vaccination. So let's talk a little bit more about the strong vaccine recommendation. Our research indicates that some pregnant women do not feel that providers are strongly recommending vaccines. Providers should state clearly that they would like her to get vaccinated, and I have an example of that recommendation here. Today, I strongly recommend 2 vaccines to help protect you and your baby against the flu and whooping cough. The vaccine recommendation doesn't have to be, tenfold. It could just be maybe simply stating that. We also have another method that health providers can use to recommend vaccines to their pregnant patients, and we like to call it SHARE. So these tips are great for general vaccine recommendations with adults, but also in the care of pregnant women. So the S in SHARE stands for SHARE, and it's SHARE tailored reasons why the recommended vaccine is right for that patient. You can highlight, which is H, the positive experiences of vaccination, and these experiences can be both personal or in practice. The A stands for address patient questions and concerns. An example of this may be the most common side effects are mild, like redness, swelling, or pain in your arm where the shot was given. This should go away in a few days. So R is remind, and that's remind patients about the protection vaccines can provide to them and their babies. And E is explain the potential cost of getting the vaccine, or getting the disease. So these costs include serious health effects with each disease for both mom and baby, time lost, whether that's missing work or family obligations, and of course the financial costs associated. So let's talk a little bit about the vaccine recommendation for parents. This conversation is going to look a little bit different once that child is here. First, use a presumptive approach by simply stating that the vaccines that the child will receive, as opposed to asking parents what they want to do about vaccines. So this assumes that the parents will accept the vaccine because national data shows that most parents do. So instead of asking the patient, hey, do you want to get a flu shot today? You say, parent, your child needs a flu shot today. So, and then instead of saying, how have you thought about the shots your child needs today, say your child needs Tdap HIV, and hepatitis B shots today. But it's important to note the presumptive approach does not mean pushing or pressuring parents to vaccinate, both of which can erode the trust, that a parent places in that healthcare provider. Many parents won't have questions about vaccines when you give your strong recommendation and use the language that assumes parents will accept the vaccines for their child. However, a small percentage of parents may be more hesitant, requiring you to spend, a little bit more time addressing their questions or concerns. So now let's talk about immunization coverage and challenges. So how are we doing with immunization coverage for maternal and childhood vaccines? So let's take a look at some of the data. So many pregnant women in the country are not getting the vaccines they need, of course. So during the 2017-2018 influenza season, 49.1% of pregnant women received influenza vaccination before or during pregnancy. 54.4% of women with a live birth received Tdap during pregnancy, and 32.8% received both recommended vaccines. However, vaccination coverage, regardless of vaccine type, was highest among pregnant women with a provider offer of vaccination. Some reasons for non-vaccination include concerns about the effectiveness of flu vaccine, lack of knowledge about the need for Tdap during every pregnancy, concerns about safety risks to babies, and then we see for both of these vaccines that rates unfortunately have remained stagnant in recent years. And we have also heard for years that women just don't know about the need for Tdap during pregnancy. So that indicates a need for stronger recommendations by healthcare providers and office staff. So as we can see from this graph, maternal vaccination rates have remained stagnant over the past 6 years, hovering at or around 50%, and the rates for the 2017-2018 season have come out, and as mentioned before, they're still at or around 50%. So on this slide, we see the Tdap vaccine coverage among pregnant women. So from 2014 to 2017, CDC conducted internet panel surveys with pregnant women to determine how many had received the maternal vaccines. The red bar here shows the percentage of women who received Tdap during pregnancy. The blue bar are before pregnancy, and the gray bar, kind of at the bottom there, are after pregnancy. The green bars reflect women who never received Tdap vaccination. So you see here, we still have a lot of work to do. The percentage of women who have received Tdap vaccination during pregnancy has steadily increased since 2014, but is still remaining at around 50%. And as we saw in the previous slide, only about half of pregnant women are receiving that flu vaccine as well. So this means that half of pregnant women and their newborns are unprotected from both pertussis and influenza. So CDC tracks childhood immunization coverage annually through the National Immunization Survey. Childhood immunization rates remained high and stable. In 2017, coverage was, around 90% for vaccination with, among 3 doses of poliovirus vaccine, 1 dose of MMR, greater than 3 doses of hepatitis B, and greater than 1 dose of varicella vaccination. 70.4% of children were up to date for the combined 7-dose series. We still face some challenges, however. Coverage with most recommended vaccines among children aged 19 to 35 months, as I mentioned, remained high and stable. We still are seeing that children are still not receiving their vaccines, however. So this graph shows how childhood immunization rates have remained stable since 2011. Although we do see some variation in coverage by vaccine, the MMR coverage being the highest and 2+ doses of hepatitis B being the lowest. So now let's go over some CDC resources and tools that are available for you. So we have many patient education materials, and we also have materials around tips on providing a strong recommendation, especially when it comes to making referrals. So first, CDC has a wide range of free trainings for clinicians most of which do offer CE and CME credits. So these include You Call the Shots. It's an online module about vaccine preventable diseases and vaccine recommendations. We have live net conferences about current issues in immunization. We have a series of online webinars about the content of the Pink Book, which discusses the epidemiology and prevention of vaccine preventable diseases. And of course, we host webcasts on a host of other topics. So you can visit the website in the blue box at the bottom of this slide for more details on those resources. CDC also has worked with Medscape. I'm not sure if you're familiar with Medscape, to provide expert commentaries from subject matter experts on vaccination within the agency. So here we have two. We have the vaccine communication with parents. There's with best practices from our Center Director, Dr. Nancy Massonier. And then also we have the Overcoming Vaccine Concerns and Refusals by Dr. Ann Shuckett. And I believe you have to have a membership to access those, but we may be able to get those out to those who want to watch those. So one of our newest products that we have are a series of short vaccination videos called How I Recommend, which feature various clinicians demonstrating how they recommend vaccines. So these two videos on this slide, and we have several more coming across the lifespan, focus on recommending the flu vaccine to pregnant women. One features a certified nurse midwife, Carol Hayes, and the other features a family physician, Dr. Pamela Rockwell. So as I mentioned, in the near future, we will be launching a similar video featuring a pediatrician talking about how she recommends childhood vaccines. We also have a video with an OBGYN who will be talking about how they recommend vaccines to pregnant patients. And then also this series does span across the lifespan, starting with childhood, who has some videos talking about childhood vaccination. And actually our adolescent team, who covers the HPV vaccine, has the most depth in these videos, and they have a ton. But stay tuned for more of those videos as they're being released. So you can check back on CDC's website and on our social media platforms. So we also have an online toolkit for prenatal care providers. This is a one-stop shop for all of our vaccine recommendations, schedules, and the educational materials for providers and for patients. So I do encourage you to take some time to look through the various resources on this website, and of course the link is there in the blue box. And if there's information that you see that will be beneficial for you, please do not hesitate to reach out and let us know. And then, so we have several digital resources available for targeting pregnant women. Our website frames maternal vaccines as a part of a healthy pregnancy. So these pages cover vaccines that pregnant women need before, during, and after pregnancy. We also have web pages geared towards our provider audiences about making vaccine recommendations to pregnant women. Our web pages are also home to several resources that include a maternal vaccination quiz that tests knowledge about vaccines during pregnancy, an animated video that highlights how to have a healthy pregnancy, along with taking care of herself, working with her doctor and getting her home ready. Pregnant women should get vaccinated against flu and whooping cough. We have the top 7 list, and it's kind of like that listicle that BuzzFeed, if you're familiar with BuzzFeed, that they kind of put out in that style. But it's a top 7 list that we developed titled Vaccines and Pregnancy, the top 7 things you need to know, that explains information pregnant women should know about vaccines and how they can contribute to protecting mom and baby. And all of these resources can be found at the link on this slide. We offer several print resources, including 2 fact sheets and posters. So these posters are for pregnant women. We have different fact sheets for providers and pregnant women. The fact sheets for pregnant women are also available in Spanish. So pasted education materials, and this is something that you all can carry over into your communications and your material development. There are posters and videos for the waiting room. They're low literacy. They're for diverse audiences and diverse language needs. They provide answers to commonly asked patient questions, and they include tips on providing a strong recommendation, especially when making a vaccine referral. And as I mentioned before, we found that moms are more responsive to messaging about the importance of vaccines for protecting their baby rather than themselves. So now I would like to switch gears and tell you about a few resources related to childhood vaccines. Many healthcare providers talk with parents on a daily basis about protecting their children from vaccine-preventable diseases. So the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians created a suite of online materials to help you assess parents' needs, identify the role they want to play in making the decision for their child's health, and then ways to communicate that meet their needs. These resources are collectively called Provider Resources for Vaccine Conversations with Parents. So these resources include guidance for how to talk with parents about the vaccine, including how to answer some of those common but maybe tough questions, plain language fact sheets about vaccine-preventable diseases, and those are both in English and Spanish, fact sheets about vaccine safety, and then information for parents who choose not to vaccinate. These resources may help you start off or continue having those vaccine conversations with parents. These materials are also effective educational tools for parents to supplement the conversations they have with them. So this slide shows CDC's immunization resources that you can share with parents. So these include the fact sheet, easy to read immunization schedules in both English and Spanish. And by the way, those were updated and released in February of this year, so 2019. And infographics and listicles. And those listicles, like I mentioned, are kind of BuzzFeed style lists of information. So the top 7 things you need to know, the top 14 vaccines, that kind of thing. So you can go to the URL listed on this slide to see the items and more, like other posters and videos. I have trigger fingers here. So our infant immunization FAQs are another great resource. So a few examples of these include, these FAQs include, are vaccines safe? Can vaccines overload my baby's immune system? And what's wrong with delaying my baby's vaccines if I'm planning to get them all eventually? So these fact sheets are written for parents of children 0 to 2 years of age, and then CDC developed these in collaboration with the American Academy of Pediatrics and the American Academy of Family Physicians. They are available in both English and Spanish, and they can be viewed online or downloaded as a PDF to print and copy for parents. So with all of this information, let's talk about the few key takeaways related to maternal immunization. So maternal immunization protects both pregnant women and their babies. Pregnant women should get a flu shot and Tdap during every pregnancy. Vaccine coverage rates remain stagnant. Healthcare provider recommendations have a big impact on vaccine uptake. And it is important to focus on effective messaging and communication strategies. So here are a few more things that we hope you'll take away related to childhood immunization. The recommended immunization schedule protects children from 14 serious preventable diseases. However, we still see outbreaks of childhood diseases like both measles and pertussis, as you all, I'm sure, are well aware of the news and in your state. Women make decisions about their babies' vaccines early, often while pregnant. Many parents have questions even if they choose to vaccinate. Prenatal care providers can point parents to credible information and also encourage them to meet with a pediatrician while pregnant. And CDC offers several tips to healthcare professionals about how to have better vaccine conversations. So I wanted to switch gears here before I get to some of the last slides, and I wanted to talk about establishing immunization champions within your organizations, your practices, your health departments, your pharmacies. So who are immunization champions? Like, what is their role? So immunization champions are those who go above and beyond to ensure that people in their community are protected from vaccine-preventable diseases. Researchers, doctors, nurses, medical assistants, physician assistants, parents who have been infected by vaccine-preventable diseases can all be immunization champions. And for us at CDC, champions are a key to our success in addressing current health challenges. Some of these health challenges could include increasing maternal Tdap and flu vaccination rates, maintaining childhood immunization rates and addressing vaccine hesitancy, reducing immunization disparities for rural populations and those living in poverty, development of new vaccines, including Zika, Ebola, and RSV, and the global eradication of polio. We couldn't have done our work without those champions. So CDC has a Childhood Immunization Champions program, and this program recognizes individuals who make a significant contribution towards improving public health through their work in childhood immunization. So since 2012, CDC has honored up to one champion in each state, D.C., U.S. territories, and their freely associated states. Awardees have included physicians, nurses, medical assistants, parent advocates, state legislators, coalition members, and more. And these champions have demonstrated leadership, collaboration, innovation, and advocacy. So these champions every year are announced during National Infant Immunization Week, which is actually next month in April, so putting that plug in. Next week in April is NIIW. And then several other organizations across the lifespan, large and small, medical associations, everyone has, a lot of people have adopted a champions and or some kind of recognition program. And then to learn more about the National Infant Immunization Week, please check out the link on the slide. So we're at the end of our presentation, but I just wanted to leave you with a few things that, what can you do? You participated in this webinar, so now after you leave, what can you do? So the most important step is to get vaccinated. What great example will you set as an individual or an organization by getting and staying up to date on your own vaccine? Next, we want maternal vaccines to be a part of a healthy pregnancy. So talk to pregnant patients about their maternal vaccines. Tell them why it's important for them and their babies, and make the conversation and recommendation memorable and compelling. You can administer the indicated vaccines in your office if possible, and of course follow up to ensure that the vaccine was actually gotten. You can use and promote our resources available, and encourage others to do the same. You can include maternal vaccination resources and prenatal information packets. You can promote the resources and products through social media channels and on your own practice or organization website. Educate your staff about the maternal vaccines, and as I mentioned on the previous slide, that could even start from your front office staff, your front door staff. Educate your staff about the importance. You can encourage pregnant women to ask questions. Have that conversation with them. Be open. Take a little bit of extra time to explain the importance of that vaccination. Identify or serve yourself as a vaccine champion in your community. And then, of course, last but not least, you can tell us, us at CDC and some of your organizations as well, folks in your state, tell us what you need to help communicate about the vaccines. You play a huge role in raising awareness about the importance of vaccines, and then CDC would like to continue to support you in that effort. And so thank you for your time today. And I think we might be going to questions. And like I said, thank you for bearing with me with my voice going out in the cough. Get a flu vaccine.
Thank you so much, Ashley. We appreciate you being a trooper and still making this presentation today. That was a lot of really great information. I just wanted to let everyone know, too, that we'll be posting those slides on immunizenevada.org/webinars. There was so many really useful resources and a lot of different web addresses. So in case you didn't get a chance to jot them all down or screenshot them while the presentation was occurring, we'll definitely make sure to post those for you after the presentation as well. Before we officially say goodbye, we would like to offer a little more time for last-minute questions, so please type those questions in the chat box now. While we're waiting for those questions to be typed in, just a couple of reminders. If you have requested nursing or pharmacy continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended, or in your post-webinar email. The email will be sent out by the end of today, and all CEUs will be emailed out on Monday, March 25th. If you'd like to view or share this webinar, like I had mentioned, the recording will be available on our website along with information for future webinars. Please visit immunizenevada.org/webinars for those details. It does not look like any questions have been posed as of now. As always, if you guys have any questions after the webinar that you can think of, please send those our way, or you can provide that within the survey itself, and we will pass that on to Ashley and seek out her expertise in any questions that you may have. And if that is it for today, we will go ahead and conclude today's NILE webinar. Thank you again, Ashley Brooks, and to those of you who participated. Have a great day.
Thank you so much. Have a great one. Thank you.
Bye-bye.
Bye-bye.